Tufts Medical Center and the South End Community Health Center have started a new clinical partnership. To tell us how the collaboration will serve patients in the South End and Lower Roxbury are from Tufts Medical Center, the President and CEO, Dr. Michael Wagner, and from the Health Center, the President and CEO, Robert Johnson. Thank you both very much for being with us. I want to start with Robert Johnson. This is not the one and only hospital affiliated with the Health Center, so how does this change things?
Well, I think we've had a pretty strong relationship with Boston Medical Center. Where we are, the Boston Medical Center is 2-3 blocks down the road. A lot of our patients go there, have gone there for many years. We're looking at the new relationship with Tufts as a real collaborative association between us where they will help provide services at the center. They will really improve the quality of services and the amount of services that we deliver to the population, which is mainly the South End and Lower Roxbury.
Dr. Wagner, coming out of this is another gateway to the South End, as it were, where you're based. What do people in the neighborhoods get from this?
So I think one of the key pieces is the access to our specialty physicians that we'll be looking to develop programs with the South End Community Health Center. So one is access to specialty physicians. Two is enhanced collaboration around primary care, the continuity of primary care. When patients do need to get emergency services or be seen by a specialist, we've made a commitment to make sure that we get patients back to the South End with the right kind of information necessary to ensure good collaborative clinical care.
Robert Johnson, you're one of several health centers in Boston that are very concerned about racial disparities and having care that's culturally competent. So how do you see this partnership advancing that?
Well, we have 60% or more of our population is Spanish-speaking, is Hispanic, Latino, and I think part of the issue for us is getting out and having access to people in the community. And I think Tufts in their marketing department, their support types of services will enable us to get out there more, to bring in more of the diversity of the South End. The major change in the South End has been the Chinese population, which has gone from literally 3% 10 years ago to about 17% today. Tufts Medical Center has a long history in serving the Chinese population, and that's a major connect for us in terms of going out and talking about our services to the Chinese population.
Dr. Wagner, this is a growing population, so I imagine it's important for you, especially when you're training providers in the future, you got to learn how to work with this population.
So Tufts already cares for a very diverse population, having many connections with multiple communities in Boston. The connection with the Chinese community in Chinatown is very important, so we look forward to the opportunity for us to expand out our reach to the community. From a participation in teaching perspective and even in research, we're increasingly becoming more connected with our community organizations so that we can, one, train the trainees of the future so that they understand that we live in a very pluralistic society and that they have to work in a not only linguistically sensitive way but also culturally sensitive way. So this will continue our goal of creating that environment. The second is from a research perspective. Increasingly we want to understand what works from a medical therapies perspective, and is more and more, we have to understand the communities in which our patients live. And so the ability to work very closely with the South End to understand how therapies work, how effective they are in an environment that's culturally sensitive is going to be very important. So we're excited about the opportunities to collaborate, not only from a teaching perspective, but for research as well.
Robert Johnson, how would you put that, the importance of working in that environment at the health center? In other words, if you have a young provider who's learning, and instead of just being in a hospital all the time, you're in the health center, I'm sure there's a different chemistry.
And most everybody in our health center right now are primary care physicians, and that's essentially what we do. We have very few specialists in the health center, and the connection with a hospital is important because that's the kind of collaboration we need to serve our patients. So, you know, Tufts provides that academic background in teaching and research. A number of our physicians hopefully will be involved in working in the hospitals, and a number of the hospital staff from Tufts Medical Center will work in the health center. So I think that interchange is critical to keep communications where they should be.
Dr. Wagner, I guess another important role for hospitals is to help with prevention or even the management of conditions so that people don't have to come back to the hospital so often. Does this partnership help in that?
So in the future world where we're providing value healthcare, much of the activity in healthcare delivery is going to be in primary care. And I'm a primary care physician by training and by avocation. And so from my perspective, increasingly, academic medical centers need to extend themselves out to the primary care setting and make sure that we're working in collaboration not only to expose our trainees and our research opportunities, but really fundamentally, that's where most of the action happens. It's in the relationship between a patient and their doctor, their nurse, and in what we call the patient-centered medical home. And the South End is a fantastic example of that dedication to the community and making sure that the patients feel they have a home. That's really where healthcare delivery needs to go and where we need to focus. And it's great for us to be able to partner so close with an organization that's been doing this for so many years, just a mile down the street, and to focus around shared community objectives like the Chinese community, the South End community, et cetera. So we think there's huge opportunity here. And this is where healthcare is going.
Robert Johnson, have you seen much of that already, the potential here for helping people with whether it's disease management or wellness, as far as this partnership that you're embarking on?
Well, the first thing that we're doing together, we're working on right now, is developing a mammography radiology unit to be housed in the center. We have really a pretty low rate of compliance with getting routine mammograms, for example, and it's around 50%. And we've always believed that, and a lot of health centers have mammography units within their health center, and we've always believed that is something that we had to do, and Tufts has offered to help us do this, without which we wouldn't be doing it.
And I guess the reason you're doing this is that you're serving populations that might be at least exposed to higher mortality rate because the breast cancer isn't detected as early?
Mm-hmm. One of the recent major grants we've gotten at the health center is a federal public housing grant. And you know, one of the challenges for us in the next several years is how to serve that population, which is across the board a sicker, less well population, and it's been proven everywhere that that's the case. And I think collaborating with Tufts is something we need in terms of that expertise to the many medical conditions that we'll be faced with. So I think it'll be critical moving forward.
Thank you both very much, Robert Johnson and Dr. Michael Wagner. We'll have more news in just a moment.